Perfect. So I will start now.
Great.
Good afternoon. My name is Costica Aloman. I am the Medical Director of Liver Transplant at Rush University, and today we're going to talk about adult-to-adult living donor transplantation. The objective for the talk today are, we're going to discuss, first of all, how it's possible to perform living donor liver transplantation. Second, we're going to learn why living donor liver transplantation is necessary. And the last part of the talk, we're going to discuss who should be considered for the living donor liver transplantation and what is the donor assessment. So how is the adult-to-adult living donor liver transplantation possible? So first of all,
sorry to interrupt. It still says that you're on the first slide of this. I don't know if you've changed slides on your end.
Yes.
You have changed?
Yes.
Oh, because we can only see the first slide. I wonder why that is. Maybe if you want to X out and go back into the PowerPoint.
Okay.
Oh, there. Now we can see it. Perfect.
So right now, you can see it?
Yeah, so right now it says liver segments on top. It says how is AA, objectives for today. So now it's moving.
So I need to start from the beginning?
Oh, no, that's okay. You can continue where you are on your slide.
So why adult-to-adult liver transplantation is possible? So first of all, the completely healthy individual has the liver volume 5 times more than minimal requirement to stay alive. And the remaining piece of the liver has the ability to regenerate. So after someone is a liver donor, in 2 months the liver is reaching the original size. The second important part is actually that human liver is naturally divided in well-defined areas inside, and surgeons are able to divide these pieces with minimal bleeding or collateral damage. As you can see on these slides, liver has 8 segments, and usually what surgeons are doing during the living donor surgery process is to divide the right and left side of the liver. And usually for the adult, they're using the right side of the liver. So how is adult-to-adult living donor transplant possible? First of all, the donor can donate as high as 70% of their liver volume, and this can be, the volume of the liver can be very easy evaluated by imaging study using the CT scan or the MRI. Second of all, the recipients need a liver volume that is proportional with their body size and should receive an appropriate amount of liver volume to fit with the body size of the recipient. Also, a very important piece is actually the recipient should not be very sick at the time of the transplantation. In this very complex slide, basically we show that actually the liver of the donor is divided in 2 pieces, the right side and left side. And this right side of the liver is used by the surgeons to perform living donor transplantation. So why the adult-to-adult living donor transplantation is necessary? So as you probably know, there is a very big shortage of deceased donor organs for liver transplantation. Almost 20% of listed patients died before receiving an organ. This leads to inflation of the MEL score at the time of the transplant, which resulted actually in a more complicated and prolonged recovery, less expected survival, and a higher post-transplant morbidity, which in other words means higher risk to develop complication and to stay more in the hospital. So what patients with end-stage liver disease should be considered for living donor liver transplantation? So first of all, any patient meeting criteria of deceased liver transplant should be considered for living donor liver transplantation as long as their MEL score is more than 15 and they are healthy enough to receive an adult living donor liver transplantation. That means they should not be very sick. That means the MEL score has to be less than 25 in the majority of the centers. So why adult? So what donor should be selected for the, what is the patients should be considered for the to be a good donor? So first of all, the donor has to be very relatively healthy individual between 18 to 55 years old and to be emotionally related to the recipient. That means the potential donor has to be part of the family or very good friend with the recipient. The potential donor has to have absence of any life-limiting disease in other organs, has to be free of any active infection and no evidence of malignancy. Also, the ideal donor should have very good psychosocial support and should not use any drug or to have alcohol addiction. Potential donor should have a relatively normal body mass index. That means they don't have to be overweight or obese. And if the liver biopsy is performed in this patient, they do not have to have significant amount of fat in the liver cells, and in this way to assure appropriate function of this piece of the liver in the recipient. Also, usually the ideal donor should be larger than the recipient. So in this way, the expected residual liver donor has to be more than 30–40% from the initial size of the liver. What potential donor cannot be considered for adult liver transplant? So first of all, if the patient is less than 18 years old or older than 55, usually majority of the centers, they don't accept them as a potential donors. If they have uncontrolled systemic disease or condition, if they have poor psychosocial support, if they're actively using drugs, or if they're mentally incapable of making an informed decision. Also, if patients undergoes liver biopsy and they found to have more than 30% fat in the liver cells, majority of the centers performing adult living donor transplant will not allow for these donors to donate their part of the liver. Also, if after evaluation of the anatomy of the liver, the expected donor remnant is less than 40%, patients usually are not accepted as a donor. Other conditions that exclude potential donor from this process are the presence of HIV infection and high suspicion of donor coercion or suspicion of illegal financial exchange between donor and recipient. If the patient has an active malignancy, uncontrolled psychiatric condition, or of course if they were prior living liver donor, this patient should not be considered as a potential donors. So what are the donor evaluation steps? There are 4 major steps before adult living liver transplantation. First of all, it's a pre-evaluation or a screening process. In this process, we are sure that actually we have a blood group compatibility. That means the donor is the same blood type as the recipient. And also we make sure that we don't have major comorbid condition that contraindicate donation. The second part, it's mainly a surgical evaluation, but also we assess psychosocial the donor. That means in this part, the potential donor learn about surgical procedure itself, and the program understand the psychosocial support and motivation of the donor. The third part is the medical evaluation. And in this part, we evaluate the quality of the potential graft, and we sometimes this step requires a liver biopsy, and also we understand if there are any medical risks for the donor surgery. And the fourth part, similar with the recipient evaluation, we have a multidisciplinary selection committee meeting when we decide if the risk and the benefits of this process are in the favor to accept or reject the potential donor. So first step, or the pre-evaluation. So the initial step that potential donor has to do is to contact a living donor transplant coordinator. After this, the patient has to register with the hospital, and we need to obtain the current history and physical exam from the primary care physician, which include blood type, the age, the sex, height, weight, blood pressure, and any necessary screening tests as advised by American Cancer Society. For example, screening for breast cancer, screening for the colon cancer. All this information are reviewed by the surgical and medical director in the institution, and if no major comorbid conditions are present as outlined in our protocol, we can proceed to the step 2. In the step 2, which is performed in the transplant surgical clinic, the patient is meeting with a living donor transplant coordinator, living donor social worker, living donor transplant surgeon, and patient undergo general laboratory and radiology tests, including screening from transmissible diseases. During the meeting with living donor transplant coordinator, patient will understand, will be educated regarding liver donation and transplantation and all elements of the informed consent for the evaluation. Also, it is provided with the informed consent for the evaluation, and living donor transplant coordinator is answering any question related with these processes. The living donor social worker will perform a psychosocial evaluation on the potential living donor, including occupation, employment status, health insurance status, living arrangement, social support, smoking, alcohol, drug abuse, high-risk behavior, and any potential psychiatric illnesses, including depression and the suicide attempt in the past. Living donor transplant surgeon will evaluate the potential donor surgical candidacy and will sign the informed consent for the evaluation with the patient. If patients understand and agreeable with the surgical procedure of donation itself, we'll proceed to the next step, which include mainly anatomical and medical risk evaluation. During this process, the patient had a CT scan and MRCP to evaluate the anatomy of the liver that will help the surgeon to design the strategy for the surgery itself. And also will meet with living donor hepatologists who will assess all the medical risk and the need for the liver biopsy. Specific for this step, it's the meeting with living donor advocate. The independent donor advocate is not involved with the potential recipient evaluation, and it's independent of the decision to transplant the potential recipient. The donor advocate is knowledgeable about the risks and benefits associated with all phases of the donation process and promotes the best interest of the potential living donor, advocate for his and her rights, and will assist with any potential donor in obtaining and understanding all the information regarding the consent process, evaluation process, surgical procedure itself, and benefits and need for the specific follow-up after the donation. Also during this step, patient is meeting with a living donor transplant psychiatrist, transplant nutritionist, and transplant pharmacist. After completion of all these three steps, the final step before donation is multidisciplinary selection committee meeting, similar with the recipient multidisciplinary selection committee. The living donor transplant team meets every week and discuss each case and evaluate the risk versus benefits of the donor surgery from different perspectives. So first of all, are other organs in the body strong enough to go to the surgery? There is the expected donor liver volume enough for the recipient. There is a favorable anatomy for surgery, and also discuss the strategy for donation from the surgical perspective. Also, for the adult-to-adult living donor transplant, other conditions are discussed, like family and friend supports, how patient listening and follow medical advice, if the patient is using any toxins or any illegal medication. Also, very important during this step is to discuss between the members of the team all the ethical aspects that motivates donor to undergo surgery. After this step, the patient can be accepted as a potential donor or can be denied for different reasons. If the patient is accepted as a potential donor, there is a cool-off period between decision of being accepted as a donor and the surgery. Anytime during this period, the potential donor can change their mind, accepting or rejecting the procedure itself. 1 to 2 weeks before donation, patient is scheduled again in the transplant clinic, will have the blood work repeated again, will meet with anesthesia and consent for anesthesia, and also will meet with the transplant surgeon to review one more time the outcome of the adult-to-adult liver transplantation in the respective center. During admission for donation, patient is seen by a multidisciplinary team, including the living donor advocate. During this process of the evaluation and donation itself and admission in the hospital, patient is undergoing continuous education, as the process of follow-up of the donor is very strictly regulated by the CMS. After the follow-up, the donors are followed up for at least 2 years in the liver transplant clinic. And based on the UNOS guidelines, patients should have at least 4 appointments during this period of 2 years in the transplant clinic, in the first 2 weeks, at 6 months, at 1 year, and 2 years after donation. Living donor advocate has a major role in assuring that all this process of follow-up is optimized for any donor. In summary, this is a very short outlook of the adult-to-adult liver transplantation. Our team here is to answer your questions, and I'm more than happy to take any questions from any participants to this meeting. Thank you so much.
Thank you so much. That was great. At this time, for the people on the webinar, if you have any questions, please type them in. If there are no questions at this time, feel free to email me with questions that you think of, and I can reach out to get the answers. And this webinar will be available on our YouTube channel as well. And thank you everyone for your time, and thank you so much for the presentation.
Thank you so much.
Bye.